My name is Sheryl Skolnick. I am a Wall Street analyst. I'm co-head of research and a managing director at CRT Capital Group in Stamford, Connecticut. I've been coming to the Revive conference for several years now as a speaker and also as an attendee. The first battleground for the winners and losers was in developing the contracts for network participation in health exchanges. And what we found is what we usually find in contracting, which is he who has the most and best toys in the sandbox gets to make the rules and win the game at the end of the day. And bringing that back to the hospitals and the health plans on the pricing battlefield, the hospitals clearly won. Now, it's not universal. There certainly are some hospitals with limited market share who didn't win, who got pricing that, quite frankly, may make them unprofitable if they get too many exchange-based contracts. They may be sorry they won because it didn't transform the way they provide the services, their cost structure, their approach to the business, and it also may not guarantee them volume in exchange for that discount, but they won in terms of the contract price. In terms of volume, so far, it's too early to be clear who's winning. Whether the health plans with whom the hospitals develop these networks, and some of them are rather narrow, so there's not all providers in the marketplace participate in these networks. It's not really clear yet. It's just too soon to tell who's actually won on that score. Whether the health plans are able to deliver volume to the hospitals as they anticipated in exchange for the discount given by the hospital. Where we're seeing tremendous victory for the hospitals is in the conversion of what I like to call no-pay heads into Medicaid in the opt-in states, in those states who did embrace the expansion. And while we're dealing with very small numbers, so the percentages look very large, the publicly traded companies have told us that anywhere from a low of about 24 or 25% to a high of 33% growth rates in their previously uninsured, newly Medicaid converted lives is what they're seeing in just the first few months of reform. So going from no pay to some pay, even if you don't make a whole lot of money on Medicaid, is better than nothing. They're going to provide better cash flows, they're going to look better on their margins, and it's all because of the Medicaid conversions. We're not seeing those kinds of percentage gains on the exchanges yet because, quite frankly, it's still just too early. But for the most part, what we've seen is a land grab for physicians. Physicians obviously have the prescription pad in hand, so they ultimately are the ones who control how much, the where, and how much care is delivered, the where it's delivered, and how much it costs, part of the healthcare equation. Hospitals want doctors, health plans want doctors, but hospitals and health plans don't want each other. And quite frankly, until that changes, we will be repeating, in my view, we will be repeating exactly the same structure that we have now, which we know doesn't work. And the hospitals are guilty and the health plans are guilty of not being able to see the forest for the trees, which is neither of their business models are correct. They can't collaborate, they can't get along, they're always at each other's throats. And I see very, very, very few instances in which that actually changes, unless there is a new structure that says to the health plan and the hospital, health plan, you're not right, hospital, you're not right. And that will require a revolution in healthcare. It is a business model that exists to some extent at Kaiser, because Kaiser isn't a health plan and it isn't a hospital. The hospital is not a profit center. The doctors aren't profit centers. They're much more aligned with a healthcare holding company. The successful models we point to are the clinic models, where there is true integration and alignment. Why does that work? Not because they're integrated and aligned solely, but because there's an independent entity who has the best interest of the healthcare marketplace and the patient within that healthcare marketplace, not the profit margins of any of the individual entities, the health plan, the doctor, or the hospital. So we have a long way to go before we find anything. And none of this is easy, and the prescriptions for getting there are really rather complex and they need to be simplified.